Here is our host, Tian Wei.
Hello and welcome to World Insight and our special program, The Frontline, dedicated to the fight against the pandemic COVID-19. I'm Tian Wei. Europe's hardest hit nation, Italy, has reached about 105,000 COVID-19 cases and recorded over 11,000 deaths, amounting for more than a third of all global fatalities. On Monday, Italy's health minister said the coronavirus lockdown will be extended at least until April the 12th, urging its 16 million citizens to stay at home. But there are some signs, some say at least, that infection cases are slowing down, with the country reporting the lowest infection cases in 14 days, which begs the question, have the COVID-19 cases in Italy at least peaked? If not, when? For answers, we talked to Professor Giuseppe Ramuzzi, who is a well-known Italian scientist who's the director of the Mario Negri Institute for Pharmacological Research in Milan. Let's hear his assessment about the latest situation in Italy and in Europe as a whole. Now we are joined by Giuseppe Ramuzzi, the director of Mario Negri Institute for Pharmacological Research. Professor, welcome to our program. I want to start by asking you how you are and how things are in your country.
The number of patients admitted to the hospital yesterday and today is less than the day before. So we start to see some possibility to ventilate more patients than we did in the past. We are passing the same problem you had in Wuhan now, and the hope that in the next couple of weeks things will be better.
Yeah. Professor Ramuzzi, one of the things people ask is that whether, besides the ICUs and the emergencies, the general public, particularly when some of the mild cases being isolated at home, should be gathered together and quarantined as a group. Professor Ramuzzi, what's your take?
The ones who had contact with patients affected by the disease or positive to the test should stay home and isolated for at least 4 weeks.
But some suggest that maybe a group quarantine is better. For example, in the makeshift hospital, rather than staying at home, because they could still spread the virus, even staying at home.
Yeah, certainly. They could spread the virus and contaminate family members unless family members pay particular attention. So if you have the facility to keep all these people who are asymptomatic but had contact with patients who were positive, and if this patient tests positive, certainly if you can create a collective quarantine place for them, this would be ideal. We in Italy do not have this possibility.
Are you planning about that, or this is not in the plan yet because you are dealing with so many emergencies all at the same time, Professor?
I don't think we are planning to do that. I don't think that we will have resources to do that. We are recommending people to stay home and take precautions. What I can tell you is that if the people take strict precautions in terms of mask, washing hands, and living in the same home, but staying relatively separated as far as food and hygienic services, these will protect them enough. I have a story to tell you. those doctors who are called now COVID doctors in some sense, because they are in constant contact with very sick patients in hospital, like in my hospital in Bergamo, or this has been in South Korea. Those doctors, despite the fact that they are in contact every hour with very contagious people, they don't become sick. And the reason is that they are very well protected. They protect themselves in a very special way, having vests, having glasses, having a false mask, gloves, and everything else. The problem is those doctors who are in the territory, family doctors,
Yes.
they are not enough material to protect themselves. So the question is to protect those people with appropriate facility. If you do that, you don't need to create big spaces for quarantine for all the uninfected patients. Also because it would be very difficult to identify them, and we certainly, in Italy, we don't have the possibility to identify all of them.
Professor Ramuzzi, since China was in the fire first, so we've seen some of the things with the latest development. Probably Italy could also be careful about. For example, China now is worried about the resurgence, meaning those patients that were treated and with the test apparently being negative, now some of them are going positive again. So from your perspective, what are some of the lessons and experiences China had encountered could be of any reference to you in Italy now?
Well, the first important things that China teach us in Wuhan was to close the contacts, to close the city. And in fact, we have closed Lombardy exactly as in Wuhan has been done. And in some particular area, like Codogno, where this has been done in very strict sense, like in China, the disease has already somehow disappeared because new cases are almost zero.
Yeah.
That's the first lesson we have learned. The second lesson is that you have to have hospitals dedicated to COVID patients. And as far as I know, you have been brave enough to build in something like a couple of weeks or even less, 2 bright new hospitals for COVID patients. This, I think, is the second important lesson. The third lesson is that you need to have enough ventilator in dedicated place to ventilate these people.
Yeah.
The fourth lesson, which is partly in China, but especially in South Korea, where this is done in a very sophisticated way, is how to test. You cannot test the entire population, because if you test the entire population, as the British seems they want to do, it means that you have a lot of resources and human forces and everything dedicated to testing. And once you have established that, let's say, 80% of people test negative, literally the day after, you should, in theory, test them again, because it could be that these people became positive, as just you said now. So the fourth important lesson is what you are saying now. Those who are cured, or those who believe to be cured, cannot left home or left places in which they have been contained in quarantine before they have at least 2 tests negative. And even so, we are not completely safe.
Yeah. Professor Ramuzi, as you may know, we just do not know much about this virus. Well, we do know some, but not that much information as much we want to. So there are a lot of possibilities, so which means experts like you have to have contingency plans while you have a crisis taking place at the same time. So many different kinds of possibilities, and you are dealing with the ongoing crisis. Professor Ramuzi, when you are on the battleground, quote unquote, how are you trying to balance these two, Professor Ramuzi?
I think that there are some important things to do. We have to understand why these people die of this unbelievable pneumonitis. This is not the usual atypical pneumonitis of transplant patients or of immunodepressed patients or of those patients who have leukemias or lymphoma, that they have depression of immune system because of the drugs, and they develop this pneumonitis. This is a very difficult pneumonitis to treat, and we need to understand that. If we understand the reason of that, and I'm sure that via the clinical research we are doing, being clinical researchers, I am a doctor myself and a research person, I think we will find out what's going on in the lung of these people. And I think that once we have understood the reason for that, the therapy will be very easy, or maybe represented by something that we have already. So I am optimistic that we can create a cure before the vaccine is ready. The second opportunity is the vaccine. I know that you have one that apparently has been just tested in human volunteer, and it will be ready by the end of December. The question is, however, that we have no idea whether this vaccine will be effective.
Yeah.
We have some idea, for instance, that if you do a test for looking at the antibodies in these patients, you may say, well, this patient has developed the antibody, so there is no problem any longer for the future. This is not true, because apparently some people who developed antibody of the IgG type, so the ones that shows that the infection was there many days before, is not recent, they may be protective antibody, but they may disappear in matter of 1 or 2 years. So
that's right.
Months. So this is a very difficult situation.
Professor, as you may know, after the European countries, the U.S. is now experiencing the most devastating time. Only maybe later in April things could change. Now, when you look on the sidelines, what the U.S. is doing right and what is doing wrong from your perspective?
I think it would have been important to decide to close the city, as you have done in Wuhan, as soon as they can. I realize that this is a problem with the economy, but the economy should be regarded as a short or long-term effect. If you are looking at the short-term effect, this may be a mistake, because it's better to have a short-term difficulty with economy than a long-term trouble. So allowing people to go around or partially to go around will undoubtedly disseminate the virus.
All right. Professor Giuseppe Ramuzi, Director of the Mario Negri Institute of Pharmacological Research from Italy. Thank you so much, Professor. Be safe and all the best.
Thank you.
Welcome back. You're watching the Frontline special program of World Insight, dedicated to the fight against pandemic. An all-out cargo charter plane carrying over 20 tons of medical supplies collected from across China took off on Monday, bound for Europe. China worked with airports, customs, freight forwarders, and airlines for swift delivery of the medical supplies to the continent. Before that, the country already sent supplies to various countries inside Europe, such as that of Greece. On this, I talked to Zhang Qiyue, the Chinese ambassador to Greece. She told me how to turn plan of support into reality on the ground. Ambassador, when I was looking at the photo, I can tell that you were very much excited. So were your Greek colleagues, shall I say, at the airport. I mean, I'm sure at that moment, some of the efforts made by all sides came to your mind, you know, all of these difficulties, one after another overcome. I guess this, in a way, it's a very interesting moment to be an ambassador, isn't it? A challenging moment.
Yes, in a way that it's a miracle. And I think many of the Greek ministers thought that we together did something. We actually succeeded in the mission impossible.
It only took 8 days from the initiative proposed by the Greek government when they were talking to you and to the final supply of all the materials inside Greece to the Ministry of Health. Tell me more about what really happened within those 8 days.
Because 8 days are really not very long. As far as the organization of these supplies, it takes a lot of work. It's really related to all the ministries and many businesses. So it's a big teamwork. So for the past 8 days, I think both in Beijing and in many places, and also here in Greece, we have worked around the clock to make sure that these supplies could come in time.
What are these issues? Tell me more about them.
Well, first of all, these medical supplies are not in one place. You know, they have to be organized from various factories, different locations, and also because, you know, in Beijing, everybody is extremely busy under great pressure, and there are many, many requests for government assistance. So my colleagues and, you know, the ministries are doing a million things at the same time. So it's not easy to have this consignment put together within such a short period of time. And then another issue is for transportation. You know, you have to bring all these supplies to the airport. That's one thing. And also, there's really not enough cargo space in the plane. So we have to find ways to make sure that things will get onto the plane. And we have handed over all of them to the Greek government, and they will distribute these much needed supplies to the hospitals.
However, some wonder whether China is trying to do masks diplomacy here.
We are not thinking about playing some kind of diplomacy. What we are trying to do is actually to save lives. I think this is the most important thing, not to put up a show or to have an extra influence on, as some of the media has suspected. I think we are here to really help all the countries that we can to prevent the spread of the disease, to contain this epidemic, and also to save lives. I think that is the most important thing now.
But Madam Ambassador, still people, some of them are skeptical, saying, well, Greece is one of those important countries on China's overall plan for Belt and Road Initiative, and that is why China is so much interacting with the country of Greece, even at this moment, to win some good hearts and minds from the country of Greece. Do you think that is the case?
No, I don't think that is a correct reading of the Chinese action. I think that is actually a misrepresentation of what we are doing and what the Chinese policy is all about. China is a country that has over 5,000 years of ancient civilization, and we have very strong philosophies embedded into the society. And we truly believe in friendship, in assisting and helping your countries, your neighbors, your friendly countries and peoples around you. I think that is already embedded into our culture. I think as great friends, we have to help each other, especially in time of need. We do this for Greek people, for the Italian people, for the Spanish people, but I think they would do the same to us. I remember that at the special moments when China had to encounter some difficulties, the Greek people helped us in a selfless way. For example, in 2011, when the Chinese government decided to repatriate some workers from Libya, the Greek people went out of their ways to help us. They, sent ships to Libya to bring our workers back. And also they allowed our workers to come to the island of Crete without, visas or this kind of, authorization, but they were given a special, approval for allowing these workers to go to Crete. And so nobody questioned the sincerity of the Greek country, the Greek government. I don't think anybody would say the Greek had other motivations. But today, when China does something, people would suspect that China has other motivations or other ulterior motives. So I think that is actually a misunderstanding of our government policy, a misunderstanding of the Chinese people. China is faced with big challenges at home, domestically, and we are helping Greece and other countries at the time of medical supply shortage. So that's why it is really not very easy to mobilize all the resources to assist others. But we are fully committed to this because we believe, as I said before, we really believe in solidarity.
The debate of the containment of coronavirus has been heated up by worsening situation around the world. Facing the global pandemic, many calls for international cooperation. So pointing fingers at each other or trying to help to save lives, that is a critical choice every country has to make. On that, I talked to Ambassador Zhang Qiyue. But Ambassador Zhang, may I ask you, there has been a debate about the source of virus for COVID-19. Now, that debate is not just within the scientific circle, it's becoming ever more geopolitical. As someone who served as a spokesperson of Chinese Foreign Ministry for years, what do you make of the current debate?
I know that there have been discussions on this issue. I think the most important thing is that we focus on our work to combat this pandemic. And this is very urgent and it's very serious. I think we all really have to pull our efforts together. Up to now, we have cooperated very well with the Greek side. Yeah. And they are learning from our experience, and we are sharing with them all the things that we have learned over the past 2 months.
But Madam Ambassador, yes, some would wonder, really, is China just about quote-unquote sharing, or is China trying to show to the others, well, this is our model, use our model, you will be fine?
No. We never wanted to give our model to other countries. We only share what we have done and the experience that we have learned over the past 2 months. And I think each country, the situation is different. So they have to take their measures, they have to take their policies according to their own situation. But it's very important to know the situation, to know the effective cases that happened before, or the cases that are not so successful up till now. So I think the learning part is very important.
What is likely to be your job, from today on because the situation in Greece is very challenging. How would you, as the ambassador from China, to protect the Chinese overseas there in Greece, while at the same time be able to assist the Greek government to provide what China can offer? And also protecting your embassy people. You have a team there.
On the one hand, we are communicating with the Greek government and the health authorities almost every hour. This morning, I received 2 calls from Ministry of Health. I also made 2 calls to the Ministry of Foreign Affairs. So we have been in very close communication. As I said before, that we are sharing information, sharing the experience that we have. Also, we're helping the Greek government to purchase the necessary medical supplies. As you know, that I think for any country, there is still an acute need for medical supplies of one kind or another. So we are trying to help them as the situation develops further. And on the other hand, we have to, of course, make sure that the Chinese citizens, the compatriots here in Greece, the students, the business people here are also safe. So we are in close contact with every one of them, each one of them. Just to give you the example that this afternoon I will organize a video conference with all the students that are here. So to send them again the message of caring, and also to ask them to take precautions. So we ask all the Chinese compatriots, Chinese citizens here to abide by the order and the rules that has been issued by the Greek government. They have already declared a state of emergency about 10 days ago, but since 2 days ago, they are going to really enforce this lockdown. So they have issued a number of measures. So we ask all the Chinese people here to abide by the rules. And also we have given them a lot of material for reading. For example, the handbook of prevention and control. And we have, from our embassy, we have a WeChat public account that we update information every day. To send them messages, so that they understand what is the situation, what are the Chinese government actions to assist them. For example, our government has set up a medical platform for consultation.
That's right.
That could be used, for all the Chinese 2,000 doctors are available 24-hour a day. To answer all the questions from people everywhere, if they have a medical issue or if they have some kind of a mild symptoms that they wanted to know how to treat them. So this kind of information is very important for the people that are living outside of China.
Welcome back. This is World Insight. I'm Tian Wei. Along with the global pandemic is the contagion of fear that could spread faster even than the virus. It leaves us some hard questions to ponder. How can we spread accurate information better than the creeping paranoia and panic? How can we help protect the vulnerable and marginalized populations? Spread the word, not the virus. UNDP resident representative in China, Beate Trankman, gives us clue how no one's left behind in a time of crisis. Ms. Trankman once worked in China 20 years ago as a program manager battling HIV/AIDS. She told me it was an experience that she would never forget. And she also told me there are many lessons of public health that have learned throughout the world since then that could help us today. Let's listen in.
20 years ago, I did my first assignment here, and I was the program manager for HIV and AIDS in UNDP China. But I think the times were very different 20 years ago. China was at a very different point in its economic development, with much higher poverty rates, and HIV at the time, especially the outbreak in Hunan province at the time, was very much a poverty-driven epidemic, because basically farmers were giving blood to blood banks, selling blood to increase their incomes. I think that type of situation in 21st century China, with the levels of development that China now has, is close to unthinkable. But of course there are parallels or things that we can learn. And I think in particular a very important lesson from the HIV/AIDS epidemic was how harmful stigma and discrimination is to an effective response. If people feel stigmatized and discriminated, they won't come forward to even get themselves tested and avail themselves of medication. And of course, with antiretroviral drugs, you can live a fully productive, close to normal life. But I think stigmatization basically prevents people from coming out. And I think for COVID-19, that's a very important lesson, because to contain the virus, we need to know where infected people are. And infected people need to be comfortable to come forward, get themselves tested, get themselves treated.
And not to link one place or one person with the so-called virus, but rather let's fight it together.
Absolutely, absolutely, which is also why WHO and the international community mulled so long over the name that they wanted to give the new outbreak, right? And making sure that it doesn't get a geographical name attached to it, because then again people from that area will be stigmatized just because of the place they're coming from.
You know, one of the things that UNDP has been working on is about how to deal with people on the edge. When COVID-19 sweeps the world, everybody feels vulnerable. Everybody, including all of us, feel being on the edge. Beata, help us to understand what can we learn from all of those experiences and best practices.
You're quite right. All of us are vulnerable, and all countries are vulnerable. And I think UNDP, as the development organization of the United Nations system, who is indeed working with the most vulnerable to make sure that people can live fulfilling, healthy and prosperous lives. Since the whole world is affected, it's all about international solidarity and, you know, closing the ranks and joining hands and fighting this as a global community. And I think what also is important to realize is, I think these type of epidemics, you know, we like it or not, they're here to stay. This will not be the last one we're seeing, especially with, you know, population growth. We're supposed to hit 10 billion people by 2050. You know, this sort of encroachment into wildlife habitats, the close coexistence between humans and animals. So I think part of the answer, and that's again what we're looking at as UNDP, but also the UN system, is about preparedness, being ready. So being ready at the international level means that you know, we need to have strong global health structures, coordination structures, governance structures for global pandemics of this sort. We need to make sure that we have strong partnerships between research institutions and private sector to be able to sort of churn out vaccines and medication for these type of occurrences rapidly. And then at the micro level, we need to basically make sure that those populations who are most vulnerable, and that is always the poor, because the poor don't have fallback mechanisms, that they can be protected and that we can increase their resilience, and that the responses prepare communities to deal better with these type of occurrences that we'll see in the future.
At a time of crisis, people have to prioritize. What are the things that needs to be prioritized from your perspective now? And as resources becoming more abundant when time goes by, what should be the way to reprioritize in a way? This is so much to the key of what you have just talked about.
China is a good example, right? Because China is in a way ahead of the world. So in terms of prioritization, I think first phase is all about containment, right? Making sure that it doesn't spread and it doesn't spiral out of control. China has been quite successful in this. So now what we need to look at is basically how do we buffer the effects beyond the health parameters, the social and economic effects. And there I think it's a twofold strategy. One is looking at SMEs and employment and the economy, right? And how do we make sure that the economy survives this downturn and can pick up again, and what sort of fiscal measures one has, etc. And the other part is households, really protecting the most vulnerable households through targeted measures.
If I could ask you one by one some of the two important points you just mentioned about the small and medium-sized companies. Now we know with almost 2 months of delay of work as a result of quarantine, a lot of them suffer a lot. Despite of promising government policies, we're still going to see a very difficult time for them. What is the latest numbers and realities you have learned?
Yeah, so SMEs are extremely important for the economy in China. They're really the backbone of local economies. They're 80% of employment, 50% of tax contribution, so 60% of GDP. So they're really the driver of the economy. One of the biggest problems is cash flow. Most of them were basically saying, you know, they're still closed down and they cannot survive. 2/3 of them said they can't survive 3 months of economic inactivity. They will have to close shop completely. So then the question is, how do you get the liquidity back into these SMEs? And the answer is trying to rein in the fixed costs that they have, right? Rents, social benefit contributions, providing also easier access to credit so that they can get liquidity injections. Those are all very important measures. And Chinese government is already taking these measures. The Beijing government, for example, has provided SMEs with a break in payment of social benefits contributions. February to June, they will be exempt. Tax breaks is another thing that many governments are looking at. So these are the type of measures to protect SMEs as key employers and as a provider of livelihoods for people.
And I guess everything has to be fast, right? We have to go with the changes very fast because things are changing fast. Having said that, though, another thing you just mentioned, Beata, is about dealing with the vulnerable and the poor community. You know, China has been setting itself the goal of eliminating extreme poverty this year, in fact. What's your latest observation as to whether that task can be accomplished? With what cost?
Yeah, that's something that we're watching very closely, because I think it will be very important that the effect of the epidemic doesn't derail China's attempt to eradicate extreme poverty by the end of the year. There is 5 million people still to be lifted out of poverty to achieve that Xiaokang goal. And of those people, a lot of them have multiple vulnerabilities, right? So you're looking at people with chronic illnesses, you're looking at people with disability or the elderly. So making sure basically that, you know, these people continue to be targeted as part of the recovery response is, I think, extremely important. But then you also have, you know, a group of population that lives just above that 2,800 renminbi poverty line, and that is subjected to other multiple deprivation in terms of health or education or access to other public services. So that group is 17% of the population. Making sure that these people, because of the effect of the epidemic, do not slide back into poverty is also going to be very important. Now, how do we do this? Making sure that the worst affected poverty counties, that there are special allocations over and beyond maybe what was planned to buffer that effect. Looking also at, again, liquidity of households, right? Deferring debt payments or other payments of poor households. Many of those households are relying on migrant labor, the poor households. 30% of them is actually main income through migrant labor. So facilitating the return of, migrant laborers to their workplaces is another thing that that can be done. So all in all, basically looking at very targeted measures that address the specific vulnerabilities of these households. And as UNDP, together with the UN system, we're looking at understanding that better, to do a rapid needs assessment, in particular in Wuhan and Hubei, so that we can support the local authorities in devising targeted measures that can buffer these vulnerabilities and actually increase people's resilience, so when the next crisis comes, they're better prepared and we're not leaving anyone behind.
A lot of information to absorb, a lot of food for thought to take away from this conversation. Thank you so much, Beate, for you and your team holding firm to your task at this very critical juncture.
Thank you so much.
And that's all we have for today's special program on COVID-19, The Frontline. To find out more, you can always find us through the search engine, World Insight CGTN. Meanwhile, you can also follow us on Twitter and Facebook accounts, as well as YouTube channel. I'm Tian Wei. On behalf of the team, thanks for watching. Bye for now.